I noticed that I was having numbness in my right hand. When I slept at night, it would be particularly bad to where I had to sort of hang my arm off the bed to get circulation back in the fingers. I had looked at a couple different doctors and most of them had had the pretty radical surgery where they cut your hand open, and then I found Dr. Westkaemper.
The Manos procedure is for carpal tunnel syndrome. Typically a patient will complain of nighttime numbness and tingling. It's usually worse in the thumb, index, and middle finger, although not always. For carpal tunnel syndrome, we will typically start with a wrist brace. And what a wrist brace does is it's going to hold your hand and keep it from bending. And we think that's commonly why people wake up in the middle of the night, because their wrist is bending and that puts pressure on the nerve. The second thing that we do is a steroid injection. The steroid medication will soothe the inflammation of the tendons and the blood is flowing better and the patient feels better. One of the problems with the injection is it will typically wear off. So it'd be at that point that we would consider surgical treatment. Or if they develop muscle weakness, or if they really just can't feel anything at all, that would be a reason to go more quickly to surgery. Several years ago, I started doing something called the Manos procedure for carpal tunnel syndrome. It's a minimally invasive technique. It's felt to have a quicker recovery than the more traditional open carpal tunnel procedure, which has been done for over 50 years.
Dr. Westkaemper was a breath of fresh air. He was very to the point and direct on what was going on. He explained why I might have heard of other options that were involved. He explained that this procedure was new, but he'd had a very high success rate on it. He made it sound like it had been being done for years.
With the Manos procedure, we have the option to do both at one sitting, although some patients are not comfortable with that. So Bill wanted to do the Manos procedures one at a time, and that allows you to have one hand that's feeling good during the recovery period.
I had the surgery done on a Friday. I was back at work on a Monday with no side effects at all as far as the surgery was concerned, so things went really well. I was really happy with Dr. Westkaemper.